welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. In our continued efforts to raise awareness as it pertains to sickle cell, we have with us three lovely young ladies that are going to enlighten us a little bit more from both the medical perspective as well as someone who may very well be suffering from it. So we get a patient perspective of sickle cell as well. So to start the conversation, Dr. Jackson, I'd like to turn to you to start us off. Can you give us some insight as to exactly what sickle cell is?
Certainly. So sickle cell disease is an inherited disease of basically the blood. What happens is you have abnormal hemoglobin, which is what the red blood cells are composed of. This abnormal hemoglobin actually causes problems when patients are under stress. So normally the red blood cell is a donut-shaped or a circular-shaped structure in the body, and it goes through the blood vessels, and because it's a circular shape, it's easily deformable. So as it goes through the blood vessels, it can move and change its shape. When you have sickle cell disease, what happens is that abnormal hemoglobin causes the blood vessels to, or causes the red blood cells to assume what's called a sickle shape. A sickle is a crescent shape. A sickle used to be an old-time farming instrument that was shaped like a crescent. And so when the patient has what's called a sickle cell crisis or gets into stress, the red blood cell will actually change into this sickle shape, and so it can no longer deform as it's going through the blood vessels. So it makes this sickle shape, and it actually kind of clumps up, and so that's what the patients perceive as a crisis, and it causes a lot of pain.
Which ultimately, then, if it's clumping, that means it's almost like it's clotting.
Exactly, it's clogging the blood vessels, so that means that the blood and nutrients can't get to the brain or the heart or whatever organ that the body needs to have that. And so when you don't get blood perfusing it, people perceive that as pain, and it's painful. Is there one set of individuals that suffer from it more than another, or are we talking about something genetic? It is a genetic disease, okay? It tends to be more common in people of African descent, sub-Saharan descent, but also people in the Caribbean, South America, and also parts of India, and parts of the Mediterranean like Greece, Turkey, those types of places. How is it then transmitted? It is transmitted, it is a genetic disease. So what happens is you have genes for the hemoglobin, and you have different types of hemoglobin, and the parents actually carry the hemoglobin trait. And so what you need in order for a child to actually have the disease, sickle cell anemia is what it's called, then you have to get one abnormal gene from each parent. Okay, if you have one abnormal gene from each parent, then those two genes come together in the child, and you have sickle cell anemia. If you only have the abnormal gene, then you actually have what's called sickle cell trait, and oftentimes you don't have symptoms. Sometimes you can have some symptoms, but they're certainly not as bad as a person who has a full-blown sickle cell anemia. I'm glad you mentioned the word symptoms, because I'm sure that's of interest to most people. How do you know? I think many of us are familiar with the word anemia, but what are the symptoms that a person would be exhibiting to say, I need to run to my doctor to determine whether or not I have this? Absolutely. The most common one is pain. Okay, so when the cells start to sickle and form that the abnormal shape, the sickle shape, you get pain, and so you can have pain in just about any part of your body. But typically, it tends to start most of the time when people who have sickle cell anemia, they start to develop symptoms after the age of about 5 months, because for the first 5 or 6 months of your life, you have what's called fetal hemoglobin, okay, and that's actually protective. So you won't have newborns, you won't have 2 or 3 month old infants that have these crises, but after about 5 or 6 months, when the fetal hemoglobin goes away and more of your adult hemoglobin kicks in, then that's when you can start to have these symptoms. And usually with kids, they start off with pain in the extremities, and so they actually have swelling. So with children, you have what's called a dactylitis, and you have hand-foot disease, so they'll start complaining that their hands and feet hurt, or you'll have an infant that's very irritable and just fussy, and you may notice swelling of the hands. Swelling in the hands and the feet. Exactly. Anything related to breathing or? There are different, because sickle cell anemia is pretty much pervasive throughout the body. It's wherever blood vessels are. So wherever you can have blood vessels that get clogged up, then you can actually have symptoms. So some of the things that you get in older patients, and by older patients I don't necessarily mean adult, but someone who's had the disease for several years, you can have lung problems or chest problems, acute chest syndrome. So you could have some shortness of breath and symptoms that are very similar to like pneumonia. Okay, you can also have problems with the heart as well. You can have a heart attack. You can have a stroke if you have problems with blood getting to the brain. You can have, again, problems in just any part of your body, your kidneys, your abdomen, just anywhere you can have that blood flows. You can have a pain crisis. So arms, legs, back.
But if I'm diagnosed then with sickle cell, are you saying then that it's like a death sentence, that I'm no longer going to be able to lead a normal life?
Absolutely not. We have plenty of people that have sickle cell disease and go on to live very fruitful lives. By all means, we want you to continue to do the best that you can. What you have to be aware of is that there are some limitations, or you just have to take precautions. And really, there are precautions that anyone should take, but you do have to be a little more careful. So patients that have sickle cell disease, you want to be careful with extremes of things, so like extreme exercise. We certainly want everyone to be healthy, and studies have shown that doing moderate exercise, generally does not put you at an increased risk. But if you're going to do one of these kind of, boot camps or just, heavy exercise type things, you want to stay hydrated. You want to make sure that you have plenty of water and stop and take water breaks. You want to be careful if you're, traveling to, say, a high altitude place. So because, again, what happens with this is anemia. So you have decreased red blood cells. So in having this abnormal hemoglobin, it also causes these red blood cells to break down sooner. And so that's why you have the anemia with it. So when you go to places that have high altitude, like the mountains, which has lower air anyway, people with sickle cell this can precipitate a crisis. If you're doing something like scuba diving, again, high pressures, this could also precipitate a crisis. But in general, you can still, live very well. And the idea is that we always want people to be active and be healthy, and not just kind of sit around and think of it as a death sentence.
So how simple is the test if we're talking about?
It's a blood test. Absolutely, it's a blood test. And a lot of places actually will have testing at birth. We don't have that here, but if there's if it's a consideration, if you think that possibly you have sickle cell, or it's on differential based on the symptoms that you're coming in with, it's a simple blood test.
Are there any misconceptions about the disease itself, how it's transmitted, if a family member has it, that there are certain things that they need to do and or not do?
Well, there are some, I think sometimes people aren't sure if it's almost like it's transmitted through, say, bodily secretions, or you can get it if you cough on someone. It's not like a virus. It's not something that's passed through the air that you get as an infectious disease. This is something that it's genetic. It comes from the blood, but it comes from the two people coming together to make another person. So that's the biggest thing.
If I may, Dr. Jackson, as a patient, someone who's being diagnosed with sickle cell, how has your life been after the diagnosis?
Well, I only found out when I was pregnant with my first son, right? I was in Guadeloupe, and I only found out because when I was little, I used to be short breath, and up to now I'm short breath. I get short breath, but I only found out as a big woman, as a big person, how serious sickle cell is. My mother used to give me liver and everything when I was a small child, but she never knew
that you carried
exactly why the doctor told her to give me liver and stuff like that. And I mustn't get wet and this and that, and she won't have grandchildren. And I won't live to be,
right.
a certain age.
Right. And now, even though you've been diagnosed with it, you're still living a productive life?
I'm living I'm living a normal life. I have two sons, two beautiful sons. One is 31 and one is 18. So,
Have they been tested?
yeah, none of them.
None of them.
No.
What have been some of the consequences of your diagnosis, though? And when I say that, the pain, have you suffered from a great deal of pain?
I've had, when I was a little child, when I was younger, I would have joint pains or my hand pains. If I'm stressed out, I would get joint pains, right? My first crisis was 6 months after my first son, which I had to go in a wheelchair. I had all my 4 joints were hurting. I was severe pain. Why they used to give me injections and everything to kind of numb the pain. But after 3 days, the pain relievers were not really helping. I felt, as if all my limbs, I can do without them because they're paining.
So bad.
And everything I can do without them. That was the first time I knew how serious sickle cell was.
Because I was going to ask you, on a scale of, let's say, 1 to 10, how would you rate the pain?
10.
Or 10 plus?
That was how terrible. I stopped eating, I stopped everything, So I stayed in the hospital for a month before they were checking me out and everything. So I stayed in the hospital for a month. It's a good thing wherever I was, they were serious with sickle cell, sickle cell patients. So I stayed.
When you said when you were pregnant, you were diagnosed, what made them look at that state? What made them say, hey, we may need to test her?
Well, the first, when I did the pregnancy test by blood test.
Blood test.
Blood test. Yeah. So I was home. I did the blood test. Yes, they said I was pregnant, but it looked after they did more tests on the blood because by pregnant this is something serious. They did more tests on the blood, so that's why they found out. And they started acting. On there right away.
Dr. Jackson, do you find that there are many cases like that it's sort of an accidental finding?
In some cases it is. Yeah, I think, before they had the neonatal screening and things like that, they would find it, especially in cases, it sounds like she had more of a milder case, that she had these symptoms early on that people probably just say, oh, maybe they're growing pains, because a lot of times when kids have pains in their limbs, you attribute it to growing pains. And so when she came in and had those symptoms and they went ahead and found the sickle cell anemia, I would say now those cases are not so much because often they will do that test earlier on as a preventive type thing. But in places where they don't do that type of testing, you can still certainly find them, especially if they're milder forms when they're younger and no one tested earlier.
No one tested. Okay. We have to take a quick break. We'll be right back. Welcome back. We're continuing our discussion as it pertains to sickle cell anemia. Dr. Jackson, before the break, we were talking about getting tested and those individuals that have been missed. However, going a little bit farther now, earlier on in our discussion, you mentioned stroke. Can you elaborate on that? Is it a consequence of the sickle shape of the blood cells as to why an individual would then have the stroke? Absolutely.
Again, the brain needs blood, and you have blood vessels that goes to the brain, and so when you have these abnormal cells, these sickle-shaped cells that block the smaller blood, the blood vessels, it causes an infarct, or it causes that part of the brain to die, and so that's what actually causes a stroke. And so you have the symptoms that we all hear about with regard to stroke, as far as slurred speech or confusion, loss of movement, and paralysis, those types of things.
When did you feel it coming on?
Well, in 2 years ago, I felt it coming on at work. I get with my first stroke, was I was at work and I felt my hand was moving, but it was not part of my body.
Okay.
So I called my doctor. He told me. He let me repeat more than once because he could hear in my voice the blood. So he told me to take 2 aspirin and let somebody take me to the hospital.
That was the first
stroke.
And then
the second one, now I was sleeping. When I wake up, when I got up to go to the bathroom, I went to the bathroom well. But when I got up, when I went back to bed, I felt this funniness in my hand. So I jumped up. I knew what the first stroke. I called my son, let him take me to the hospital. I said, hospital. Because I knew what was going to happen.
Is there any way, Dr. Jackson, to prevent this? Is there what preventative maintenance, if you would, is there for whether it be the person who is in crisis, the individual who's carrying the trait? Because I'm sure that's one of the questions our viewers are going to have. If I'm diagnosed, then what do I do now?
Sure, absolutely. And the big thing is really, an ounce of prevention is worth a pound of cure.
Right.
As far as prevention, you want to make sure you're going to see your doctor. You should have regularly scheduled visits at certain times. This is not a disease where you wait until you're feeling bad to go into the doctor, because there are things that they can do kind of preventively to keep you from getting to that bad point. You certainly want to, again, make sure that you're staying healthy. You want to have, some level of exercise. You want to stay hydrated. You want to kind of keep not a stressful life, because again, when your body is stressed, whether it's a physical stress or an emotional stress, this is what causes your cells to sickle, and you can go into crisis. There are also different medications that are out, that you can use, and there's more research and things going on all the time. But certainly the big thing is that make sure that you're making your appointments, you're going to your doctor, and you're doing what your doctor says.
And you use the word research now. What is being done to, first of all, raise awareness? I mentioned at the outset we wanted to do this to continue raising the awareness. What is being done to raise awareness about sickle cell? Because again, as we're constantly talking about hypertension, diabetes, and I think sometimes people fail to realize that there are other things out there that need to be looked at as well within our community. Would you be able to speak to that as far as the research that's being done, the awareness plans that are being done?
Okay, well, at present, and even before now, like for the past 2 years, we have really been trying to mobilize efforts in terms of getting different programs on board. Now, we went into the Ministry of Education last year, a couple of us, and we spoke to them there and asked them in terms of going into the schools and lecturing to the kids. But I mean, it just doesn't stop there in terms of lecturing to the kids. I think we want to take it a bit further. Well, I mean, the vision in my mind is to take it to the limit, because whatever I do, I go to extremes to make things happen. Because when you have stuff happen, it's a situation where not just one person need to benefit from it. As the giver as well as the receiver, needs to get whatever it is they're getting from it. So we have been going to the schools, a couple of the clinics and stuff like that. And this month here, 19th is World Sickle Cell Day. And we have some activities surrounding that. The first starts on Saturday the 15th, and it culminates on the 22nd, which is a Saturday also. We start off with church service, and then the Monday we have media day. The Tuesday we pretty much have wanted to go into the place to sensitize again and create awareness, because you have people who have sickle cell working in different offices, and people don't know how to deal with them when that time comes. They might probably handle them a bit too rough, and they're not really able to handle that at a point in time. And then on Wednesday is World Sickle Cell Day. We're going to be in town on Long Street, right in front of the museum, having up tent and stuff. Now, the focus there is pretty much healthy lifestyle. Sometimes a person says, well, yeah, you didn't do it yesterday, but yeah, I'm going to do it today, right? If I didn't do it yesterday, I'm going to start today. You start today adopting a healthy lifestyle and different things. You change your diet, you exercise, and whatever the case may be. And even if you have any type of illness, be it sickle cell, as we say, hypertension, whatever, diet, lifestyle, they all change. Once you change that, it can reverse the course, be it slowly or whatever the case may be. So that's what we're trying to focus on. I have asked different people to come under the tent, who pretty much, deals with that aspect in terms of the food, type of food stuff they sell. I'm hoping that they would really come on board with that. And that's one of the main areas there, as well as, of course, the exercise program. We have the guy with the insane camp to come there and do some demos, as well as people on spot can pretty much participate and do what they have to do. That's on the Wednesday, as well as fundraisers. On the Thursday now, we're going to be giving back to the community, because it is so important to give. It's so important to volunteer your time and do whatever is necessary. So we're going to be soliciting, getting fruit baskets, and giving back to people with sickle cell, as well as we want to target, because it's Father's Day, the oldest father in Antigua, and give him like a package, right? And that's the Thursday. On Friday, however, now up on Mount St. John's, we're going to have an all-day lecture. Like, we have a couple of schools coming in, then we have like some of the medical professional nurse doctors, and some nice, good doctors who know their stuff, of course, will be lecturing. Not saying that anybody don't know their stuff, but I mean in terms of the pivotal points that we really want to get through, they're going to be lecturing like all day thing. And on Saturday now, culminates with a walk around town. We're going to be going into town and doing our bit. The police band is going to be there on board, you know. And right now, as I said, we have a lot of people who are really rallying around us to help us create that awareness that we need to get to whatever point we are getting.
Okay. Sounds like you've got a packed
Absolutely.
week.
Absolutely.
We're going to take another quick break, but when we come back, I'd like to elaborate more on the awareness that's being done. We'll be right back. Welcome back again. We're continuing our discussion as it pertains to sickle cell. And you were talking about, Diane, raising awareness, but you said something in your comment that struck a chord. Many times when we look at raising awareness, we're trying to raise awareness with regards persons that may have the disease. Mm-hmm. But it's not just the people that have the disease that need to be aware.
That's right. Because
you mentioned person's jobs and not knowing how to deal with an individual mm-hmm. that may go into crisis. Have you seen or had any experiences? Or?
Yes, I have. I was working with the ministry, I was like health social improvement thing. There was this young lady I was working there, and she had sickle cell. Now, I really wasn't too much aware of it at that point in time as to know what sickle cell was about, you know, before I actually came on board with it. And she will get crisis while she was on the job, and I mean, she will like, you know, take it. And people want, how to say, they will look, some people just like, you know, is she faking? Because probably she might have, you know, been up and about like 10 minutes before, and then like 10 minutes after, you know, it's like she's like in this kind of way, crouched, double up in pain and stuff, and then she would end up in hospital, stay 3 days and come out. And some people in the workplaces don't understand, as I say, what is happening at that point in time. So really and truly, in as much as with the sickle cell client, you have to educate, you have to counsel the work people around them, their workmates and stuff, the employers. Because in terms of fact, when the employers think that, wait, why is this person being sick all the time? Now, some people are forthcoming with their employers that they would tell them they have sickle cell right away, right off the bat, and maybe tell them, you know, well, it's not affecting me as much or whatever the case may be. Some people even lose their jobs as a matter of that, you know, because...
Why would they lose their job?
Because sometimes the situation where the employers find they might not be productive enough, because they might be staying home like for about a week. Because some people definitely get heavier crisis than some. It all depends on the individual, right? And I mean, you end up in hospital for like a week or whatever the case may be. And if these crises come on, now it is on your part as well as the individual who have the disease, who have the sickle cell, to take care of yourself. You've got to look, as Dr. Jackson was saying, you got to hydrate. Water is the key. Water is so important, because I remember this Professor Guy Dyson from London. He has a program in the schools, and those are some of the things that he keeps focusing on: hydration. Allow the kids to go to the restroom when the time comes. Allow them to have water in the classroom that they can be able to drink the water. But some teachers won't really allow it, especially if they're not educated. So that's why education is the key when it comes to knowing how to deal with it. As with every other illness, education is the key, sensitization.
Do the parents inform the teachers that the child may have sickle cell?
Well, in some cases I know they do. I believe they should in every case. I cannot speak for everybody, but some of the cases that I know, yes, they do. They tell them. But still, I mean, as with every sickness, when it happens, you know, the kids might just look on, because it probably might be the first thing they might attack, they might be seeing, and wouldn't know really how to relate to it. But I guess after a while they would get accustomed. But it is important that I guess they tell. I mean, the truth always works out good anyway at the end of the day. You need to be forthcoming, you need to be upright. Tell the person who has to, you know, think what's happening.
You mentioned the week of activities that you have going on, going to be going on in the days to come. Yeah. But what's being done regionally? Because obviously sickle cell is not just an Antiguan thing. Dr. Jackson, you alluded to, especially within the black community or the Caribbean community, it is a disease that we're predisposed to have. So can any of you speak to what's being done within the region to raise awareness as well as treatments and so forth for sickle cell?
Well, I'm going to briefly put on my other hat,
Okay.
which is my Coscas hat, the Caribbean. I'm the Secretary of the Caribbean. And just last night I was talking to my president, she's from Grenada, and she was telling me that we need to get onto PAHO's list because PAHO has communicable and non-communicable diseases.
Right.
So we sent out a circular for people to submit the names of the among the people in their islands that probably, the clients that they deal with. Because being on that list of PAHO is a situation where, of course, you might be able to get a bit more perk, whatever. You're on PAHO's list is deemed as important. So we were trying to rally around that as well as with the CARES group. CARES group is a group from Guadeloupe. Right? Their researchers in sickle cell and beta thalassemia. That is what in Caribbean, yeah. So they have been here in May. They came actually to launch the project, to pilot the project of neonatal screening. Now, it's a situation where before it really happens, all the stakeholders have to really sit down and wait, as with everything else. The pros and the cons, and see if it's good for us, if it's not. So that is in the process of happening now. So these people from the CARES group, they're really willing right away to start, and they're going to carry us for 2 years. Because that's what we kind of initially requested of them while we were in St. Lucia last year. And they're willing to do it, because really right now it's €3 per child to test, to do the heel prick test, and they're willing to do that. Now, if we wait, after the 2-year period, it goes up to €10, and 10 would be 10 tens 100 EC, right? 3 tens are $30. So we're going to be saving $30 EC on every child that is going there by, they're helping us. So it's a situation where I think it's a good thing, and we really need to get on board with it. But those are all the areas that we are trying to filter. Now, we as the COSCA group, with the conference that's coming up in October, we're having a conference at Jolly Beach, 18th and 19th of October, with different people coming from all over the islands, plus America, plus Canada. So we are hoping at that point to at least have something to report. Now, it's a situation where AUA is helping us in terms of working along with us to do a database, because at present there is no thing as to how much.
We don't know how many sicklers there are.
Some people go with a percentage, but I'm not really for the percentage thing. I'm really for the direct facts as they are. So there are people keep calling in based on advertisements in the paper. They call in on a daily basis sometime to help us. I was telling Dr. Jackson, we need to get them involved. And Wednesday, I think, on the street is a start for that. They can come out in the numbers, anybody willing to volunteer, and there's where we can really start and pilot that project and get out there. Because when I was working at one of the other places, the government place, that's the way that we did it. To get your facts, you've got to have people go out in the community. You befriend the people, be nice, and after a while you just get what it is you need in terms of information. Then you can compile it, and there you have a database, and we have it pretty much up and running. And then we can better be able to help those individuals out there and be that bridge to wherever it is that they need to go.
Understood. You're doing a tremendous job. Please keep it up.
I want to say thanks to all the committee members of the ABSCA, Antigua Barbuda Sickle Cell Association, that we meet a planning committee up at every Tuesday at Mount St. John's at 5. Those young people who come into the group are really, really vibrant and really raring to go. And I really want them just, stick it out. Just, it's going to get there.
It'll get there.
We're going to get there.
It'll definitely get there. Ladies, I'd like to thank each and every one of you for sitting down with us. Before we go, though, Dr. Jackson, from a medical standpoint, what are the last few words that you think our viewers need to know about sickle cell?
That you need to know your status. That is the Antigua Barbuda Sickle Cell Association, KYSS, Know Your Sickle Status. That is kind of our logo, our theme. Exactly.
KISS.
And so, KISS, exactly, KYSS, right. You should know your status because, again, this is a serious disease. It can take years off of your life. And so it's very important that you know what your status is, because you can't tell someone has sickle cell disease by looking at them. You can't tell they have the trait by looking at them. If you have two people that have the trait that come together and make a child that has sickle cell, this is going to be a significant impact on their life. So it is so important to get tested and just know your status.
Diane?
Yeah, well, I pretty much want to wrap up by saying thanks for having us, and we really want to make this a collaborative effort. You know, everybody work together towards one goal. You know, as I said, we're not trying to like supersede anybody. We just want everybody to come together for the betterment of the people of Antigua, Barbuda, Caribbean-wide, worldwide. And as long as we continue working together, you know, and whenever the time comes, it's going to be fine.
And it will work. Don't give up. Don't give up. And you have the last word. You know, and your word is very important because I think you embody what it is that we're trying to get across.
What I would like to say to the parents up there, when your children is complaining, you know, they have a pain, don't take it easy. Don't say, oh, they're lazy or something like that because they don't want to do this or they don't want to do that. Have it checked out.
Get tested.
Have it tested, have it checked out.
Know your status.
Know your status.
Kisses.
Thank you, ladies, so very much again.
Thank you.
Okay.
It was a pleasure.
It's been a pleasure indeed.
Thank you.
We'll take our final break. We'll be right back. Whether we like it or not, sickle cell anemia is a part of our society. It's a part of our culture. And while it is not a death sentence, it is definitely not something that we should ignore. It's important that each one of us know our status, and in that regard, we're able to take care of ourselves and our family members accordingly. Check with your doctors if you have any doubts. If you have questions as it pertains to sickle cell or any other matter, please feel free to contact us at bewell@auamed.net. Take care of yourselves. Thank you for spending some time with us today and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.
Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.